This week we'll be talking about narcotics. There's a YouTube video I'd like you to watch, so pause now and click on the YouTube video. So just a bit of information about what narcotics are. So it does come from the Greek word for stupor, so it causes a dreamlike effect. Higher doses can induce sleep, so it can be used as an analgesic or as an anesthetic, so kind of putting people out for surgeries and such. An analgesic meaning for pain relief. And I'm going to talk about the three main categories of narcotics. So opium or opiate derivatives, so products coming from the opiate. And then synthetic opiates, so man-made but are very similar to what an opiate is. So opium specifically, so from the opium flower, so it can be divided into three categories. So morphine, codeine, and theanine, which are the top three. And all of these opiate derivatives are derivatives of morphine. So specifically morphine has been broken down and created these specific opiate derivatives. Synthetic opiates are man-made, so they're very similar to opiates and opiate derivatives, but they've been manufactured by man to imitate the effects of opiates. So methadone would be the one that's most common and most well known. So it's used for the treatment of opiate dependence or narcotic dependence. So people who, for example, are addicted to heroin would go on methadone as a way of stopping the use of heroin. So opium itself, it's harvested from the opium flower, so a poppy, and it's mostly in hot climates. So for example, in the Middle East, it's common to be grown there. So laborers make small incisions in the capsules of the poppy flower. It allows the milky white juice to ooze out, and the next day, after it's hardened, it's scraped off and kept, and then it's turned reddish brown. So some history. So it's been known for a long time. In the 2nd century AD. They were recommending opium for everything, and this is a very early example of overprescribing of a substance. In the 11th and 12th centuries, crusaders were returning to Europe from the Arabs, regarding as therapeutic. So the Opium Wars in the 18th century, a lot of history from the British, China, India, bringing it back to Britain. And also resulted in China losing Hong Kong to Britain and causing China to legalize opium in their country. So history of morphine. So it's in 1803, it was an isolated product as an active ingredient, and it's been in 1856 when they created the hypodermic needle. It allowed the morphine to be directed into the blood system as opposed to going through the stomach system, which does not work, as we will talk later on about. Heroin, it was invented by the Bayer company, so the same company that invented aspirin. It thought it wasn't as addictive as morphine, and it was used for pneumonia and tuberculosis because opiates are known to calm cough. It was thought to be helpful for pneumonia and tuberculosis. But then about 12 years later, they figured out it was addictive. Heroin is more addictive than morphine because it's more fat soluble, so it gets into the fat tissues in the body and it stays there, so it's more it stays in the body. So synthetic opiates. So in the 80s, things like black tar, China white, which are all very similar to heroin but much more intense, and some more pure, and it's more cheaper. It's cheaper than heroin. So heroin, so they found that it no longer needs to be injected due to the purity. So because of how pure heroin has become, it doesn't have to be injected. It can be snorted or smoked. It can also be mixed with cocaine or crack cocaine. It's increased use because now you don't actually have to inject it, as people weren't using heroin because they were afraid of needles. Now there's a way of bypassing that. So the effects of the heroin on the body can change depending on the quantity and the purity of the actual substance, the way it's administered into the body, how long since the last dose, so if it's been an hour or if it's been a day, and the tolerance, so how long you've been using it and how much your body has developed a tolerance to it. So intravenous, so if it's injected, it has a rush or a flash of euphoria, so a very calm sense, and the tranquil drowsiness or being on the nod. So people, it looks like they're kind of floating in and out of consciousness, they're kind of nodding their head. This can last about 3 to 4 hours. But people who have never used heroin before and use it for the first time, it's a very unpleasant experience, a lot of vomiting, nausea, but you still have the sense of euphoria, which is an odd combination. So some other effects, so it can be itchy, your red eyes and pinpoint pupils. So depression and breathing. So because it is a depressant, it actually slows the breathing to a point where if you take enough of it, it could actually stop your breathing altogether. Decrease in blood pressure, so your blood pressure is actually slowing. And constipation, which is actually another depressant effect because it's slowing down your body systems. So some other brain effects. So receptors in the brain are specific to morphine. So pain receptors in the limbic system. Naloxone, which is an opiate antagonist. So this is what is used in emergency departments or in injection sites for people who have overdosed on heroin or other opiate derivatives to help reduce or reverse the overdose symptoms. So the brain produces morphine-like chemicals that activate the receptors. So they're actually already in the brain that are morphine-like chemicals. So it's activating the receptors. So your brain already produces chemicals that are similar to morphine, but when you take morphine, it's actually activating them. So abuse, there's many ways of abusing any kind of narcotic. So mainlining, which is actually injecting the substance directly into the vein. Smoking, snorting subcutaneously, so skin popping. So that's similar to like a TB test where you put it under the skin. But oral administration, so eating it, drinking it, whatever, is very poor way of taking it. Doesn't actually give the high as the other ways do. Tolerance. So anybody who's taking heroin or any other narcotic will always have the unfortunate constipation, but the pinpoint pupils will go away with chronic use. The more you use them, the less likely you'll have the pinpoint pupils. Your greatest tolerance is seen in the degree of analgesia, so pain relief. So if you're taking heroin or other narcotics or opiates or whatever in the beginning, you'll have a lot of pain relief, but your body will build a quick tolerance to that and you won't have the feeling of pain relief. Euphoria, the very first time you take heroin or any other opiate, you'll have the most sense of euphoria, and then that you'll build a tolerance to that and you won't feel it anymore. And the respiratory depression. So when you first take any narcotic, you have more of a likelihood of causing a respiratory depression, but it does decrease that chance as you take it, but you might also take more of it to get the high, so you might actually have a greater chance of dying from respiratory depression. Withdrawal, so you'll have cravings for about 4 to 6 hours, but this could still continue for 36 up to 3 days. Withdrawal is generally complete by 10 days, but you still might have some other symptoms for up to 6 months. Withdrawal severity depends on the dosage of heroin, so it can be like a flu or worse. So coming off of heroin is like the worst flu you will ever have, but it's not usually fatal. So lethality, so it has a small lethal dose, meaning it doesn't take a lot to kill you. Purity and dosage are different, so it'll depend on what it's cut with. If you're adding it to something else, it might actually make it more likely to die by it because of whatever it's been added with. Tolerance that is related to the environment. So this is seen in people who go to the same place with the same people, whatever, the same habit on or the environment on when they're taking the substance. So if they go to the same place, inject with the same people, the tolerance might be related to that environment. But if one day they decide they're going to take the drug in another way or another place, the tolerance might be different, and they might actually more likely to overdose because they're taking it in a different area. Allergic reaction can be common. Other diseases, so if you're sharing needles, for example, it could also destroy part of the brain, and which can cause Parkinson's disease. We've talked about dopamine and different parts of the brain in previous PowerPoint presentations, and this is no different to heroin. So some treatment options. So there's opiate detox, this reducing heroin gradually, but unfortunately the cravings can still remain. So just because you have physically come off a substance doesn't mean you've psychologically come off it. Methadone is one treatment. So this is an oral synthetic opiate. So it's been created by man as a way of dealing with the withdrawal symptoms of an opiate. So generally it's prescribed in a liquid form. It's drank with some kind of orange juice of sorts, and it's given every day, same time every day, because it only lasts 24 hours, and it helps to normalize the body. So meaning it helps prevent any cravings. There's no high to it. It's really just keeping a level of opiate in the system that allows the body to function, so there's no withdrawal symptoms. This, again, some people say that it's like no other, it's just similar to any other drug in that you're hooked on it because you can't just stop it or you're going to have withdrawal symptoms. It just doesn't give you the high. So it is again really hard to come off. If people want it to wean themselves off, it takes a while. So some other treatment options. So some drug-free residential places. These are usually peer influence to learn some social norms, develop social skills. Counselors there are typically former abusers, so it's a peer-driven program. Multimodality programs, which can combine all of the above. Medical uses. There are medical uses to any of the substance that we've talked about. So relieving pain. So any opioid can reduce pain. So people who are in severe chronic pain, in terminal cancer patients, they can be prescribed some of these substances. Treatment of acute diarrhea, because it is one of the side effects is constipation. And suppression of coughing. So, for example, somebody who has pneumonia might be prescribed codeine as a way of dealing with the coughing. Adverse effects. So respiration can be depressed, like we said, and to the point where it might stop. Problems with the intestines, and not to be used to induce sleep because it can reduce respiration, so you might just stop breathing. Misuse or abuse. So some of the substances now, OxyContin, they've talked about, they've changed it into a gummy form. Unfortunately, people have figured out how to abuse this anyway, so it hasn't actually stopped the problem, even though they were hoping that changing the form of it would. And by changing the way you're administering the substance can change how it impacts the body. So medication that's prescribed, like Percocet, if you're crushing it, inhaling and injecting it, it will completely change the way it affects the body, and it can be very similar to heroin. And this is the textbook that we've pulled the information from.